Hey guys, what's going on? Welcome to another video on my channel Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipeline. Visit my website at HAIRLICIOUSLY.com to purchase your microneedling device, which is scientifically proven to stimulate hair growth, my low-level laser therapy cap, DH debulking shampoo, conditioner, and serum, hair growth vitamins, and a few other products to help those who are losing hair. What's going on, Justin? It's good to see you again.
Dude, thank you so much. What's up? I'm doing great.
Yeah, man. So how's everything been going?
Man, it's been going fantastic, dude. I just finished up my summer internship. I'm about to start my senior year of college, and so I'm really excited. I just, as of, let's see, 2 days ago-ish, I hit my 3-month mark since I got the surgery.
Yeah, I kind of wanted to wait because, that transition between the first month and the second month, there's really not much going on after the hair falls out.
Yeah, exactly. And kind of with month 3 as well. I will say over the past week or two, I've noticed it's kind of started to grow in the recipient areas. And it's like,
Okay.
it's like growing in more so. So I feel like the shedding is done, but now it's like starting to grow back. So it's still very thin in this area, and I still
Yeah.
have that how it kind of like dips down because these hairs right here are a lot longer
Yeah.
and have been growing longer. So still gotta be patient. I will say I'm really excited because I've been telling everybody 8 to 12 months is the final results, but now after seeing my progress over the past couple of weeks, I feel like maybe month 4.5, month 5.5, I could be really seeing some fuller results.
Yeah. Are you exactly at 3 months, or are you kind of like 2 months and a half? What's like the exact the time frame?
So my plane arrived in Istanbul May 14th,
May
and
4th,
then I guess it was the next day I got the surgery, so May 15th.
May,
Uh,
July, August. So yeah, it's exactly at the 3 month mark.
yeah, exactly the 3-month mark.
Yeah.
I'm either right after this call or tomorrow I'm recording my 3-month video, and then this weekend I'm editing my 2-month video. I
Mhm.
haven't posted it. Wait, actually, yeah, my 2-month video. I haven't posted it because I don't know. I just gotta edit out all the ums and pauses and stuff. But
Yeah. There's a
they're
lot of
much quick.
fans. They've been waiting for your videos, and I've been waiting for an update too, but I haven't seen any. So we got to
Yeah,
keep on doing these Skype sessions.
I have it. Oh yeah, true.
Yeah.
I have the footage. I record it at the time of each month, so I have the footage, and I posted almost exactly 1 month ago.
Okay.
So
So
yeah,
are you starting to notice like a little bit of like peach fuzz growing in? Because I can't really
yes,
tell from, because you've been growing out your hair, right? Yeah.
yeah. I've been growing it out. I only cut it once by myself. I think I used like a number 6
Yeah.
setting,
Yeah.
and I did that. I think at a little after month 1, and I did that just because. Yeah, it was growing longer. I don't know. I just thought it would look good, and I was satisfied with that. But I haven't cut it. I haven't like had a professional barber cut it ever since the surgery. I will show you if maybe you can see a little peach fuzz. I'm not really sure.
Yeah, I can see a little bit. Yeah. Yeah.
Yeah. So
Man.
it's still very thin in these areas. But yeah, I've noticed it's like starting to grow in.
I mean, that's normal too. Like, even when I had my first hair transplant, I didn't notice any growth until like the maybe 3.5 month mark. But that was kind of like when they were just starting to grow in. Everything was just very faint. These hairs are very thin. But as the months progress on, you're gonna start seeing more growth. It's gonna thicken up, and like, don't be alarmed when you see one side growing faster than the other, because that's totally normal. They're not
Yeah, I know.
at the same rate.
I've seen a few other people how it does that, like how it's like one sheds faster than the other side and then one grows back faster than the other side. So
Mhm.
I've seen that. It's totally normal.
Once you progress like into probably your 4 month mark, that's when you're gonna kind of start seeing a lot more growth. But
Yeah.
right now, like, even if you don't see that much growth, don't be alarmed. Don't be scared, because that's normal. and a lot of people are not going to be, early responders. Typically around the 4 to 5 month mark is kind of like when they start seeing the results, and it can go upwards to 12 months plus. Some people take up to 18 months. I think most doctors tell their patients that around the 12-month mark is kind of like when they're going to see the final results. But you might be a slow grower and it might go upwards to 14, 15, 16 months.
Yeah, definitely. It's definitely a game of patience, and I'm not alarmed at all. It's going really exactly as good as I hoped and expected it would go so far.
Yeah.
So,
And there's
yeah.
no this. I can't even see any signs that you've actually had a hair transplant done.
I know it really looks almost exactly like if I had not had a hair transplant at this point.
Yeah. So as far as like all the redness, everything's just subsided. Do you still have like
Yes.
areas where it's kind of still numb, like the extraction areas or the recipient site, or did all of the cessations come back?
So last time I spoke to you at 1 month, I told you that my extraction area
Yeah.
numbness was gone very quickly, and the numbness actually left my extraction area before my recipient area,
Hmm.
which was different. Which was different in your case, you told me.
Yeah.
So now, I think it was at about 2.5 months in, I noticed I gained full feeling in the recipient areas. So there's no more numbness whenever
Okay.
I touch these areas.
Hmm.
Used to, it would feel like kind of like my forehead just goes further back, but now it feels like a scalp area. So it feels just like I'm touching any part of my scalp. So the numbness is gone everywhere.
Okay, that's good because mine lasted for months, and it,
Wow.
it it really depends on each person. Some people, like yourself, after a couple months or so, they're going to get all of their cessation back. Mine just took up to, I think, like, I don't know, 4 to 5 months, especially like the extraction area.
Right.
So I mean,
Wow.
yeah, yeah. I mean, technique might have been a part. Different doctors use different techniques. They use different needle blades.
It
So
must be. It must have something to do
yeah,
with being able to make those smaller incisions that Cosmedica has. It must be.
yeah,
But
yeah.
other than that, I feel super confident. Like all the markers of a good hair transplant are apparent to me because I looked at, I look at, do they have the right insertion depth of the hair follicle? And I know that they nailed that because right after, or about 2 weeks after my hair transplant, when the hairs were still in my scalp, they were the exact same length as all my other hairs. Also, if they insert it too shallow, then you can notice the cobblestoning effect,
Oh,
which I don't have.
okay, good.
My scalp looks and feels the exact same in the recipient areas as it does in the places where I didn't have anything done.
Mhm.
The angle looks perfect to me. The staggering effect looks perfect to me. So all the markers of a good hair transplant, the healing time
Mhm.
healed super fast. So all the markers I can see is just really blown away by how well it's looking so far.
Yeah, I mean, like at this point, you probably don't even think about it, right? Until probably starting like next month when you start seeing a little bit of growth.
Yeah.
But it's kind of like the awkward stage where nothing's really happening. Did you have any shock loss in the in some of the native areas? Did you notice any
I
like,
I think
additional?
so. I
Yeah.
think so.
Okay.
Yes, yes, yes. I think so. I
Mhm.
think so, especially like on this side a little bit. I think there was like a little bit of shock loss going in that direction.
Mhm.
Um, yeah.
Do you mind showing us the back of your head? Because I know a lot of people are interested in seeing how it looks like, 3 months post-op.
Mm.
And I mean, you've been growing out your hair, so it's going to be a little bit more difficult to see. But, sometimes if you go to the wrong doctor, there's cases where they might over harvest a certain area. So you can kind of tell certain areas are kind of depleted. But if you don't
Okay.
mind showing us the back of your scalp, just so that the viewers can see how it's looking at 3 months post op with 3,000 grafts that were extracted.
For sure. And I don't have a tripod, so I'm gonna try to
Yeah.
make sure. lower my seat here and try to get as close as I can here. I hope it's zoomed in enough, but tell me if I need to like lean back more or
Oh no, it looks pretty good. Yeah. Let me see the sides too. Yeah. It looks pretty. It looks like you haven't even had a hair transplant.
really. I know that's so crazy because like even if I like feel
Mhm.
back here, there doesn't feel any like difference of thinness. Um, like going up to where there was no hair extractions, to back down lower where they were extracted. So it's like it doesn't even feel like any difference of thinness.
Yeah, and the thing is,
Or
there's a lot of discussion going on, especially from different clinics from Turkey, where these people get 3,000, 4,000, 5,000 grafts, and they end up with a just completely over harvested, depleted donor area, and you can tell even with the hairs growing in because you can see kind of like all these sparse areas in the back of the back of the head. But in
yeah.
your case, I don't see anything like that. So I think it's healing
Oh,
good.
that's great. That's awesome.
Yeah. Now the other topic that I'm probably always going to bring it up, but a lot of people are also interested in medication, right? So we've talked about this. I know that previously you weren't looking into medication. Has your stance changed after our last session? Are you currently taking any hair loss medication? And if not, do you plan on taking it? I'm probably going to keep on asking you this. It's
No,
something.
I don't mind at all. I don't mind at all because you're looking out for me and you want the best result possible, and I do too. So whenever we talked last, I had just started taking minoxidil, doing the 1 milliliter application 2 times a day whenever I wake up and then go to bed.
Okay.
And I've continued doing that. So I've been doing that for a couple months.
Okay.
So I should start just, the efficacy really kicks in after I guess like 3 or 4 months or so. Um, and then the finasteride, I at 2 months I started taking, what is it, 1 milligram. So I have 5 milligram tablets, and I split that up so that I'm taking about 1 milligram a day.
Oh wait, you
And
started taking finasteride?
yeah, yeah, yeah.
Okay. Wow, nice. Because I remember last time you were almost opposed to taking it. Oh, I mean, well, not opposed, but you kind of didn't want to take it, and you just kind of wanted to wait and see how everything turned out. But what changed your mind? Like, because because last time you just said, I'm just gonna wait it out, and I'm not gonna take finasteride until maybe a few years from now on, if I start noticing thinness or whatnot, then you said you're going to jump on it. But what changed your mind to jump on finasteride?
Yeah, so I looked a little bit into some studies from the National Institute of Health,
Yeah.
and I saw that you can actually have there's pretty good efficacy for just 1 milligram of finasteride taken orally, and about 50% of the patients that were doing, or actually 60% of the patients that were trying that
Mhm.
uh, reported good results. So I noticed just by taking a little bit where there's like extremely minimal chance of side effects that you can have positive results. So that's what I'm easing into, and as possible as the life goes on, I could up the dosage. I like to try to keep options in my arsenal if the hair loss becomes more aggressive.
Mhm.
But yeah, so I feel more comfortable. I haven't noticed any side effects from the minoxidil, and I don't think I haven't seen any. I've been taking the finasteride for 1 month so far, and I haven't seen any negative side effects from that. So I'll just keep monitoring that, and maybe I will increase over time.
Yeah, man, that's good news. Like
Yeah.
honestly, I thought you weren't going to take finasteride. Like I'm not trying to push anyone to take finasteride, but I feel that it's recommended because even if you're using minoxidil, it's not going to do anything to treat the androgens, right? Minoxidil it's a
Right.
stimulant, so
Yeah.
I'm happy to hear that you are finally on finasteride. Welcome to the club.
Thank you.
It's a good thing that you don't have side effects. Most people are not going to experience any adverse side effects. And like for myself, previously I've actually switched from oral finasteride to topical dutasteride. But when I was
Ah,
taking, yeah, when I was taking oral finasteride, I took half a milligram. And if you look at some of the studies, like 1 milligram and half a milligram of finasteride, the efficacy is pretty negligible. So if you wanted to potentially even lower your side effects, you can try just taking half of a milligram,
that's interesting.
of finasteride.
I might look into that and consider weaning myself down to half a milligram then.
Yeah, because if you look at it, man, like scalp DH suppression between 1 and half a milligram is pretty much equivalent. So there's no need for you to take the 1 full milligram when half of that is just going to be just as efficacious. And I think the study goes down to even like 0.2 milligram, right? 1/5 of a milligram, which some
Really?
people
Wow.
take. Yeah, because in the US, they prescribe you 1 milligram finasteride. They don't give you the 5 milligram of Prosker. I think a lot of other foreign countries like Turkey, other places in Europe, Canada, they actually give you Prosker, which is 5 milligrams. But yeah, I mean, whatever works, dude. Like, I'm just glad that you're on a finasteride. It's really going to help, slow down the, further progression of hair loss. And you're pairing that up with a growth stimulant with minoxidil. So I think you have your base covered. And for most people who are taking finasteride and minoxidil, um, have you started microneedling? I know Dr. Jar gave you the derma roller. Have you?
Right. He gave me the derma roller, and I also have a microneedling pen. They gave me like a little instruction sheet for like various things,
Yeah,
and that thing says wait 10 months to start microneedling. I feel like I would probably be safe to start microneedling now, but
yeah.
just to be, I don't know, on the super safe side, I guess I'm just like waiting a little bit longer, but I'm definitely going to jump into it. Yeah, I have the equipment. Going to do it.
Yeah, cool, man. Wow.
Yeah.
Glad that you've been adding all these treatments to your arsenal.
Yeah, dude. I've also
It's a
been taking,
shocker, to be honest.
huh?
It's a shocker, to be honest, because the last time that I talked with you, you weren't on. I don't know if you were on minoxidil, but you weren't. You were definitely not on finasteride. And you just, I don't know, man. The last time that we talked, it just sounded like you just didn't want to take finasteride. So good to hear that
I,
you finally made that conversion to take finasteride.
yes, dude.
Yeah,
I'm glad I did, and I'm glad you're watching out for me. I was open to doing it back then. I just wanted to dig in a little more and look at the studies a little more for myself.
yeah. And topical finasteride is also another option. Especially,
Topical finasteride.
yeah, topical finasteride. Yeah, I've talked
Interesting.
about it a few times in some of my prior videos, but basically the efficacy of topical and oral finasteride is pretty much the same in terms of hair count. But the good thing is that it doesn't reach your serum DH levels as much as oral. So that means it's going to be less systemic. You're going to be bound to less side effects. So that's why a lot of people switch over to finasteride topically. But if you're not experiencing any adverse side effects from oral finasteride, there's really no need for you to change to the topical.
Interesting. Okay.
Yeah, yeah, I would highly recommend that you read up on it. It's pretty interesting because you're applying something more localized on the scalp, so it really makes
Exactly.
sense.
Yeah, I would be honest. I really like the idea of putting it topical medications better. I'm more in favor of doing that, but I've noticed the minoxidil, I guess it contains maybe a little bit of ethanol, and that might dry out my scalp a tiny bit, I've noticed.
Yeah,
So that's like a tiny little negative. Um, so yeah,
you can.
maybe yeah,
Yeah, try the foam version of minoxidil. You
the
can go
foam
to
version.
Yeah, you can go to Costco. That's the one that I use. I used to use the liquid version, but then, like you said, it dries up. Yeah, the scalp. It causes irritation for some people who are sensitive to, PG or ethanol.
Right.
So try the foam version, and it
Oh,
also absorbs quicker, or it dries up a lot quicker too. Because the liquid version kind of gets all sticky and it feels all nasty and it gets all up in your hair. But the foam one, I think some of them don't even contain alcohol. So you might look into some of the ingredients, but Kirkland brand is pretty good. And if you switch over from the liquid to the foam, I think it's gonna be better for you.
Interesting.
Yeah,
Okay.
yeah.
I will look into that. Other than that, I've been taking like daily like vitamin supplements that they gave me, like the zinc and the amino acids, and then like the vitamin B, B12 supplements that they gave me, and
Mhm.
then they also gave me like this what do you call it? It's like an anti-hair loss shampoo. It
Okay.
has like caffeine and other various vitamins, and I've been mixing that with like some moisturizing shampoo like tea tree mint shampoo, and then sometimes Selsun Blue. So sometimes I'll like alternate and like do one day do the moisturizing shampoo, and then the next day do the anti-hair loss shampoo that they gave me. And sometimes I also like to like mix them up and like do them at the same time.
Do you notice any like dandruff or any itchiness on the scalp area?
As long as I do like alternate and do like the moisturizing shampoo somewhat regularly, then I don't have any like dandruff or itchiness or anything.
Okay, and you don't have any
But
like folliculitis or any like pimples on the recipient area or anything like that?
what was the first one? Something alitis?
Yeah, folliculitis, like inflammation
Oh,
in the follicles where you get like pimples and you gotta like pop the zit and
oh, you know what? There actually was, I guess I want to say in the first month in the extraction area, I would get like it was like acne pimples, but on my scalp. And so that's really died down a lot, but I did in like especially the first month I did have some of those. And it was like, I didn't have that before the hair transplant. So I guess it's just like some irritation, but it feels like it's like pretty much resolved to where it's not doing that anymore. So I'm not positive. I think I want to say that's mostly from the hair transplant. It's not from the minoxidil because it happened in the donor area, and I'm not applying minoxidil down there. I'm applying the minoxidil on the top of my head. So
yeah, you know what was weird for mine? Well, actually for even both hair transplants, like the donor area, you know how they extract the grafts from the back of the scalp?
yeah.
Months later, like there were times where I would just get like this intense itchiness and then I would just kind of like break out in hives. It was so weird.
Really?
Yeah, yeah, like
Int-
still yeah, it still happens like every once in a while, but it might be something, I don't know, man, like something with like my autoimmune system acting up. I don't know, because it's weird. And I've read of other people who all kind of had like the same symptoms, but I wasn't sure if you experienced anything like that. So
Interesting.
it's weird.
Interesting.
Yeah, yeah.
Yeah, yeah. I mean, I did definitely. I mean, I wouldn't say I've never had hives. Um, so not anything that crazy, but I definitely did have some like acne pimples in the donor area. And it was like, you know how sometimes you have like a surface level acne pimple that you can like pop, but then sometimes you'll have like an acne pimple that's like kind of beneath the surface and you can't really get to it or pop it or anything.
Yeah.
So I would have a few of those too. But I think that the moisturizing shampoo, especially the like the Selsun Blue stuff, I
Hmm.
think that like really soothes the scalp. So
Okay,
so
cool.
yeah, I would recommend that to anyone who's um, experiencing that
Yeah. You gotta share all of this on your channel.
for sure. For sure, man. I will.
Yeah. Justin, it was good catching up again, man. 3 months post-op. And I know a lot of the viewers were very curious to see how your progress is going. Unfortunately, we can't really see much at this stage, but
Right.
hopefully during our next Skype session at 4 months, fingers crossed, you're going to see more growth, more density, and you're going to be able to actually tell a difference between right now and hopefully you'll have more of like an established hairline. The good thing right now is you don't have any redness. It basically looks like how you look like prior to the hair transplant. So
Exactly.
very excited. I know a lot of people are rooting for you. They're looking into your journey.
Dude,
Uh,
I know they're so nice. You sent so many friendly, nice people my way. I didn't expect it.
Yeah, and you're also helping out a lot of people, man. Like
Yeah.
there's a lot of people who are interested in going to Cosmedica or even just other clinics in Turkey or different clinics all over the world. And I think just sharing your journey with all the people who are losing hair and contemplating getting hair transplants is really gonna gain a lot of information from you. So thanks again. Do you have any questions? Anything that you want to share with us before we hang up?
Um, I think I mentioned the supplements, I mentioned the shampoo, and I think I touched everything that I was hoping to, man.
Okay, cool, man. Sounds good. I look forward to our 4 month update.
Me too,
and
dude. I think I'm gonna really see. I was looking at a testimony the other day of somebody who was like really impressed with their 4 month results. And so who knows? It could be 4 months, it could be 5 months. We'll see.
yeah, keep your fingers crossed. And like you said, I did see some people who started noticing like 20% density improvement after like their 4 month mark. So hopefully you're going to be a good responder, an early responder. And I look forward to our next chat, man.
Dude, thank you so much.
All right, Justin. I'll be in touch, dude. Take care.
All right. Have a good one.
All
Bye.
right, bye.